Hi, I'm Nurse Bob. Today my topic is heart attacks, which I've been talking about on my other blog, Nurse Bob's other blog. I'm going to cover the symptoms. I'm going to talk about exactly what a heart attack is. And I'm going to talk about what the risk factors are, what we can change and what we can't. Now, I haven't forgotten about my other topic, which has been total parenteral nutrition at the end of life. It's just that I still need to do some more research before I bring the whole series of segments to a conclusion. So let's get started with heart attacks, and hopefully you'll find some useful information here. All right, we're going to talk about heart attack. As I mentioned a moment ago, I'm going to talk about what the symptoms are, what the causes are, and actually what the outcomes can be, and I'm going to talk about risk factors. So let's go back to symptoms. There are differences between genders. Women have very different experiences than men when it comes to a heart attack. And this is actually fairly recent research because the vast majority of research that was done on heart attacks was done with men. It wasn't done with women. So it's only recently that they've been exploring what happens with a woman when she's having a heart attack. So the things that you want to look for if you are a woman is you want to pay attention to whether you're having difficulty breathing, if you're having trouble sleeping, if you're feeling sick, nauseous but for no apparent reason. You can have feelings of fear or nervousness. Now, if you're typically have those feelings, that's one thing, but if this is out of the blue, pay attention to it. If you're suddenly having new or worse headaches than you've ever had before. Now, of course, there can be an ache in the chest or a feeling of heaviness or lightness in the chest. Interesting that, it can be either way. A burning feeling in the chest or pain in in your back between your shoulder blades. It feels like you just can't quite get it straight. A pain or tightness in the chest that spreads to your jaw, to your neck, shoulders, ear, inside the arms. These kinds of radiating pain are always something to be paying attention to. And of course, finally, if you're having pain in your belly, in your abdomen, particularly above the belly button. Let's talk about what goes on with men when they're having a heart attack. Again, there's the classic symptom of chest pain, discomfort, feeling like there's an uncomfortable pressure or fullness or, squeezing like a vice. And the pain is actually quite intense. Other discomfort or pain in other areas of your body. Often, for men, the pain will radiate down one or both arms. It can radiate into your neck and jaw or down your back and in your stomach. Again, shortness of breath. And finally, there's the abdominal discomfort, that feeling that you're having indigestion. So again, these are symptoms that need to, you need to pay attention to these. And, it's much better to go to the emergency room and have it checked out and maybe be a little embarrassed that, it was the triple taco than it is to wait it out and have your heart progressively suffering from, irreparable damage. So, when you get these symptoms, check it out. Okay, so what is a heart attack? Well, it's either a loss of the heart's ability to pump. There's a condition called ventricular fibrillation, which basically means that the whole heart is just quivering. It's often described as, vibrating like a bowl of Jell-O. If this condition is not corrected, it's pretty rapidly fatal. Or the other possibility is a blocked blood vessel, either in the heart or leading to the heart. Now, the heart muscle and nerve tissue that are behind the blockage, after the blockage, will begin to die very shortly after the blood flow stops. What's going to happen down the road? Well, if you survive, that dead and damaged tissue is replaced with scar tissue, and the nerve damage affects how the heart is able to pump. The scar tissue in the muscle basically results in a weakened area in the heart, and of course it doesn't contribute to any pumping. Afterwards, well, like I said, it depends. It depends on what caused the stoppage of blood flow. If it was due to the heart fibrillating or, trembling and not pumping at all, if it's not corrected fairly quickly, you die, so you don't have to worry about it. But, if you are lucky enough to have somebody there who knows CPR, cardiopulmonary resuscitation, where they're doing, pumping on your chest and, keeping the blood circulating, then maybe you're going to, have a better outcome. The longer you go without the heart beating effectively, the more damage is done to the organs, especially the brain, and of course kidneys and lungs and everything else. What else does it depend on? Well, if it was a blockage, a clot somewhere in the heart, again, it's going to depend on how long it's lasted and how much of the heart is involved. If it's a blockage of the main coronary artery, which is what feeds the entire heart, again, it's kind of like VFib. If you don't take care of it quickly, if something doesn't break down that clot and get blood flowing, you're probably not going to survive. If it involves a very small portion of the heart, you may not even know about it. It may be what's called a silent heart attack, which damages some portion of the muscle or perhaps a nerve. And if it's intermediate, well, you're going to have the pain and the symptoms. And if you get to the hospital quickly, where they're able to perhaps give you drugs to break that clot down and get the circulation flowing again, or they go in and intervene with some kind of a stent, or which is a device that they use to open up the blood vessel, then your chances are better, and you may have a better outcome. What else does it depend on? Well, what's the initial health of your heart? How healthy is your heart? If it's never had problems before, it's going to be able to tolerate some of this a little bit better. And even if there's damage, the rest of the heart may be able to, sort of pick up the slack. If you've had multiple heart problems, is this the one that pushes you over the edge? You're not going to know. And of course, how healthy are you? Are you fit? Do you exercise regularly? Again, the body is able to tolerate a lot when it's in good condition. It has a lot of reserve. If you unfortunately have a long health history with respiratory problems or circulatory problems, you may not have any reserve, or you may have very little reserve, and so the outcome again may really depend on all of these conditions. And so what's the takeaway message? Well, unfortunately, it depends.